Today, we will discuss the application of handheld ultrasound in cosmetic medicine. The application of ultrasound is vital for diagnosis in many fields of medicine by assessing the anatomy and flow through Doppler ultrasound. Technological advancements have made handheld ultrasound more cost effective and accessible for point of care use. In cosmetic medicine, handheld ultrasound devices have made ultrasound more accessible, integrated, and indispensable in this field. The 2020s marked the era of incorporating ultrasound into cosmetic medicine via handheld ultrasound devices. In recent years, Botox and dermal fillers have become more sought after in cosmetic medicine due to the influence of social media. According to the International Society of Plastic Surgery, there is an approximate 7% increase in Botox and dermal fillers from 2021 to 2022 and a 39% increase from 2018 to 2022 across men and women of all ages from 17. This is similar in Australia and New Zealand. In 2018 in Australia, $350 million was spent on Botox alone, and the projected trend is upwards. In New Zealand, according to the New Zealand Society of Cosmetic Medicine, there is an increasing demand for Asian patients getting cosmetic injectables to westernize their faces. However, heightened demand comes with heightened risk. Blindness is considered a significant adverse effect of dermal fillers. Belesne et al. Study has shown that there are 146 global cases of blindness. Other major adverse effects include skin necrosis, oculomotor nerve palsy, and choroidal ischemia. Belesne et al.'s literature review on the left image shows the locations of the face where dermal fillers were injected into critical blood vessels and caused visual impairments. While most clinicians can avoid critical blood vessels, there will be patients with variable anatomies or have had previous plastic surgeries, so complications can still happen even in the most experienced clinicians. The International Congress for Dermatology, Aesthetic, and Plastic Surgery proposed a flowchart that shows ultrasound can be applied pre and post treatment. In pre treatment, ultrasound can be used for tracking pre filled areas and vascular mapping. In post treatment, ultrasound can track the filler's location that is causing complication and guide the hyaluronidase injection to effectively dissolve the dermal filler. There are many benefits of handled ultrasound in cosmetic medicine. The most important benefit is patient safety because it allows clinicians to see where they are injecting and thus reduce the risk of complications such as blindness. Additionally, ultrasound will foster research on the behavior of dermal fillers underneath the skin and help us understand how they interact with the patient's underlying tissues. Finally, ultrasound is an educational tool that can help patients understand the risks of injecting fillers in dangerous areas. There are many ultrasound devices in the market, but there is no perfect handheld POCUS, so each probe has advantages and disadvantages. The main advantages of handheld transducers are portability, user friendliness, cost effectiveness, device compatibility, anesthetic preset, and in general, high quality images. However, the disadvantages vary between transducers. Regarding portability, wireless transducers are more portable but heavier due to the batteries inside the transducer, which causes wrist fatigue for the sonographer over time. The battery is also not suitable for long scanning sessions. Secondly, although handheld ultrasound devices are more cost effective, it has been shown that conventional ultrasound devices still produce a superior image quality. Finally, the scanned images are usually stored in a cloud facility, which requires regular subscription payments. Park et al.'s study in 2023 is the only research that compares handheld focus devices in aesthetic medicine, with a particular focus on image quality. They have found that Clarius L20 provides the best image quality in imaging dermal fillers and facial and orbital arteries, as shown in the Doppler ultrasound image of a supratrochlear artery on the top right of the slide. Visualization of smaller arteries depends on the patient's anatomy, sonographer, skill, and probe used. Clarius L20 has the smallest footprint that can fit into the crevices of the face, as shown in the bottom images. Note that 3 ophthalmologists have done this study on 3 volunteers, with a 5-point marking from 1 strongly disagree to 5 strongly agree or very satisfied. Therefore, more studies must be needed to compare the POCUS devices in cosmetic medicine. Handheld ultrasound physics is the same as that of a conventional cart-based ultrasound. It relies on three basic components: the ultrasound probe, wire or wireless connection, and the ultrasound machine, which is in this case the tablet or a smartphone. The transducer acts to send sound waves and receive echoes from the body. In handheld ultrasound devices, the transducer contains an active element technology, which is either made of piezoelectric crystals similar to the conventional ultrasound transducers or a silicon chip. PZT crystals mechanically vibrate when voltages are applied to produce sound waves, and vice versa. A voltage is produced when it receives sound waves. This is the piezoelectric effect. Other probes, such as the Butterfly IQ Plus, have a silicon semiconductor sensor chip, which contains a 2D array of capacitive, micro-machined ultrasound transducers, or CMUT. This is similar to an array of silicon drums, each of 208 microns, with a speaker and a microphone that vibrates when voltages are applied. When echoes are received, there is a change in capacitance, which is then converted to electrical signals. With CMUT technology, different frequencies can be applied and no backing material is required, unlike conventional ultrasound probes, thus rendering it more lightweight. Both CMUT and PZT offer high-quality images. CMUT offers a wider bandwidth, thus wider range of frequencies. However, it does not rely on the crystal sizes and shapes unlike PZT. Handheld ultrasound systems can be wireless, which relies on a Bluetooth to send information to the probe, powered by a battery pack that produces the applied voltages. A handheld ultrasound device uses a smartphone or a tablet as its operating system. The images are displayed, processed, and optimized through the app to make an accurate diagnosis. These are images produced by Clarius L20. The bottom image is an anechoic dermal filler in the mandibular region where the gain is optimized for visualization. The right image is a transverse Doppler ultrasound of a superior lip where beam steering is applied for optimal visualization of flow on the vessel. Now we will look at complications of dermal fillers on ultrasound. This slide shows an ultrasound image of a dermal filler injected into a parotid gland, which is prone to inflammation and requires rapid and accurate injection of hyaluronidase. The dermal filler in asterisks appears scattered, well-defined, and anechoic, closely relating to a pseudocyst. However, different dermal fillers appear differently on ultrasound. This slide shows a colored Doppler ultrasound image to locate intravascular occlusion caused by post-treatment of dermal fillers. This image is interesting because it contrasts the effect of complete vessel occlusion caused by the filler on the left lip compared to the right lip, with patent blood vessels showing vascular flow in color. This slide highlights the importance of Doppler sonography in cosmetic medicine. There are many impacts of handheld devices on sonographers as the demand for ultrasound increases in cosmetic medicine. Firstly, it is important to integrate sonographers into their clinics to greatly enhance the utilization of handheld ultrasound devices, thus creating future career opportunities and an extended interdisciplinary scope of practice. The sonographers can perform facial vascular mapping before cosmetic injectables, or they can scan alongside a clinical injector for occluded vessels and effectively dissolve the dermal fillers. Secondly, there is no additional training required to use handheld ultrasounds as they operate in a simple technique, similar to a cart-based ultrasound, thus knowledge of B mode and Doppler ultrasound is required. If cosmetic clinics need a specialized sonographer, a vascular sonographer is qualified to perform these. Thirdly, it is easier for sonographers to carry a portable probe, so they are not limited to a particular location, especially in emergency cases of vascular occlusion. In conclusion, as discussed earlier, the demand for cosmetic injectables will continue to rise, despite publicly known associated risks such as blindness. Based on the studies and reviews, ultrasound has shown great accuracy in discerning variances in patients' anatomies and the location and depth to which injectables are administered. With handheld ultrasound devices, ultrasound can be integrated into cosmetic medicine to promote patient safety by enhancing the accuracy of injections and rapid detection of complications. However, more research is required to compare different handheld POCUS machines to determine which one is the best fit for cosmetic medicine, and more studies are needed to aid awareness of the effectiveness of sonographers in cosmetic medicine. Thank you.